Hi guys, how you doing? It's been a little while since I posted,
Boys,
so
hey guys,
hey boys,
giving
just
the boys water.
yeah, and they can see you on camera.
Yeah, I know.
So yeah, I haven't posted in a while, and so I thought I need to post a video. I'm trying to block the light coming from the window behind me, so that's why I'm all like So my little
You know, right?
well, I'm on. Well, okay, there you go. I'm up and down. So I it has been 6 months now since my surgery, and I thought I should put together some uh, some rules to keep in mind. Not actual, rules, but kind of guidelines to help yourself through um, trying times because this has been very trying for me.
This doesn't apply to me,
What?
these rules.
Yeah, they do.
Well, they do, but I mean,
They apply to everybody.
yeah, but I'm the one that comes off that surgery and goes back to work.
Well, yeah, you shouldn't though. Anyway, here's my list of rules. Number one, make expectations, but make realistic expectations. So, what I mean by this, um, you know, we went on Google when I found out what surgery I would be getting, and initially I fought it, and it, it's a good thing. You want options. You want to know you're in the best care. One reason I fought it was because I didn't want these doctors here to do it because nobody here knows anything about CP, and I felt like it was a quick, easy answer. Especially once I read into it and all this stuff, and so but figuring that this was the operation I was going to get, um, we read into recovery time and things like this, and what to do afterwards, what not to do, all these, just all these things that, um, and I had it in my head. You know what? I'm younger, which I am. I'm younger than most of the people who have had this surgery. Some of the people having this surgery are bedbound or just something that that I'm not, and so that's okay. You know. But so I'm a badass. I thought I was a badass. Well, I am. But I had it in my head that I'm going to be all better within 4.5 months. Here it is, 6 months later, and I still have pain. I still have spasms. I still have really, really terrible bad days that just make me wonder if I'm getting better at all. But realistically, I think, yes, I am getting better because if you knew me before the surgery, if you ever came over um, within a year, really, before my surgery, or even a few months afterwards, I'm sure you can see that I am better than I was because I was in really bad shape. So, um, we read that this surgery can take what minimum of, I think it was 4 months. And that's where I got that other idea. But minimum of 4 months to like a year. And so I just put it in my head like, okay, 4.5 months, we're good to go. Um Be realistic. It's okay. It's okay that you're not better in a month after heart surgery. I mean, I mean, you're gonna have days where you're gonna wonder what's going on, and that's okay. Um, but so yeah, be realistic. You can plan. You can make expectations for yourself. You can make goals, and I think that's a very good idea. But keep in mind that um, you're gonna fall back, and that is okay. So, rule number two, kind of going off of that, is be kind to yourself. I have a hard time with that because I'm always like, oh, you know, you should be better right now. You should be doing this. You should be doing that. Like, why are you still in pain? Like, what's going on with you? What, like, it's okay. No, like, um, what was it, like a week and a half or 2.5 weeks? So I think it was a week and a half after my surgery. I was crawling. Technically, I was crawling that same night. No, I don't think I was crawling the same night. But a week and a half later, I crawled, what, 10 feet across the floor, and I felt so happy. Um, be kind to yourself. Just, um, like, cheer, cheer the milestones, Um, um, like, congratulate yourself. Just don't beat yourself up. Don't be me. Um, because yeah, any surgery. This is my first surgery, so but and hopefully my only surgery. But I can imagine every surgery, even a kid's surgery, is is hard and I mean something people don't actually want to go through, and but it's necessary sometimes. And just know that you're doing the best job that you can, and love that, you know. Um,
especially on a weight bearing limb.
yeah,
I would say. I mean, cats gotta be a bitch, you know.
yeah, it is, and it still is. Um, at 4 months, I was able to stand on my knees almost like I used to for 10, 20 seconds. And then something happened. I think it was my switch in medication, and I could not do that for another like month and a half almost. And I was really beating myself up, like, why can't you do this? You were doing this at 4.5 months. What's wrong with you? Like, um, but keeping in mind too, I didn't have any physical therapy because of all that stuff, going on, and I was denied. I think it was the agency you could see. I don't know if it was them or my insurance. I think they were kind of, I don't know. So I never got any physical therapy, so whatever I did, I did. I didn't learn it from anybody. I just had the will to do it, and so but now uh, I'm getting back to the point where I can stand on my knees just a little bit again, and so I think my meds are regulated and I'm getting stronger. But so yeah, just celebrate the little things and the big things, and don't beat yourself up. because it's okay. Rule number three, be upfront with people. I had no problem with this. Um, except, well, people who knew me before the surgery, like friends who haven't seen me in a while, and say they come over and see me now, and I'm like, hey, or old caregivers, same situation, they come back after a couple of years or whatever. Yeah, I'm like, okay, I'm gonna need some extra help. It's not gonna be the way it was before. I don't have uh, my balance anymore just yet, and I'm gonna need extra help with this. And the only thing I really get embarrassed about is having to wear dang briefs or pull-ups or whatever you want to call it. Just because I never had to before a year ago. And then that's when it started getting so bad I could not get on the toilet anymore. And so that's the only embarrassing part for me. And that probably shouldn't be embarrassing either, but it's just people knew me before. They knew I was crawling everywhere. I could crawl all over this house, chase the boys around, do this, do that. Like, just if I drop something in the kitchen, I get out of my, go in the bedroom, get out of my chair, crawl all the way through the house to pick up the thing, get back up to the bedroom, decide, hey, I gotta go pee. So get on the toilet, go pee, do that, get back in my chair, and then mildly, maybe moderately tired. But so now it's like I crawl 10 feet and I am exhausted. um, like I said, other than the pull-ups, I'm not. I have no problem telling people. Now, when it comes to that, I'm kind of like, yeah, so temporarily, this is going on also, but it's just something that that might happen. I mean, you may have a hip injury, you may have a broke your foot or something. I mean, just whatever it is. Um, it's it's okay. Just find yourself some good pull-ups. Yeah, 'cause- yeah. And going back on, be kind to yourself too. Don't beat yourself up about stuff that you can do because you're gonna do it again. Um, now I had an incident where being up front with new caregivers, old caregivers, friends, just whatever. We were booted from Triple C. I think you've heard about that, maybe? Have you heard anything about that?
No, wait, wait, go on.
So, and then I joined another company, and
Got booted from there.
I got booted from there. But it was because the supervisor didn't talk to me first. That was one of the major issues, I think. Um, she came one morning to watch my caregiver, how she helped me. I specifically told the supervisor, people do not need to do it this way. She does it this way because she's a badass. She is. She could lift me. She could throw me across the room if she wanted to. She could carry me for miles, I'm sure. I'm very sure. So she does it a certain way. I said, you do not need to do it this way. As long as, well, not even as long as. I said, if the person can lift at all, that's terrific. If they can't, I have a way to lift. Lifting is covered. Don't worry about it. I can teach them how to use the way to lift. Um, this is going on. This is going on. I'm wearing pull-ups. Um, I used to balance better, but this is what it is right now. It's all good. So Then a day later, she came during the night shift to watch how the caregiver helped me at night, just so she got a full scope of my routine. But again, I told her, don't worry. Again, the caregiver did not need to do it in this particular way for me to get what I need. As long as we both feel good about what we're doing, we're not hurting each other or ourselves, or no one's getting hurt. It's all good. So the next day, I got a call from the agency whose name is St. Joseph's, um, and they said they are dropping me from their service. They already called my case manager with my insurance, and they told her this, and for reasons that they cannot staff me, which I didn't understand at all because I had a morning caregiver and they just found me a night caregiver. So I'm like, what are you guys talking about? I'm covered. Um, and furthermore, they said that a report um, was made on me uh, by, I think they told me who it was. Which, anyway, one of the supervisor I had been dealing with to APS, which if you don't know is Adult Protective Services. Um, and she claimed on the report just these incredibly false, exaggerated issues, like our boys like just poop and pee all over the house, all over the floor, and I'm having to crawl in it every day, and just how unsanitary and unsafe that is, and just about how like our house is a wreck, and just all these ridiculous things that are completely untrue. Um, the APS social worker got here, so that was Thursday. So she came on Friday. She was pleasantly surprised that none of that was actually going on, but they couldn't close my case until certain things were met. And so, um, I mean, me and Jason are in the system because we're, on SSI and all that stuff. But I mean, nobody wants to be in the system because APS is on their butts. Especially for for things that aren't even going on. If I was, APS isn't even for that. It's like it, I'm just saying it's not gonna happen. But Jason was abusing me, or I was being horribly neglected in some way. Like so she shouldn't have even called APS at all. But especially on the grounds that none of those cases were true. So even if you're upfront with people, it's not a sure thing they're gonna understand you, obviously. Um, but be upfront with people, and it's okay. It's If they don't like it, I mean, you can't control what they think or what they like, or. But if you're honest and you're upfront, then you've done your job. So, um, my fourth rule: look to the future. Um, so let me see. What I mean is, why did you get the surgery in the first place? Obviously, it was to not be in pain anymore, or not die, or whatever you were facing. Um, like I said, you're gonna have bad days. And you're like, when is this gonna end? When's my pain gonna end? Yeah, I fluctuate so much because um 2 weeks ago I told Jason like I 5 out of 7 days of the week I don't have a spasm at night anymore. Like, this is crazy. Only 1 to 2 days a week do I actually have a spasm, and when I do, it's I can count out on one hand how many I'm having. So I was like, wow, I'm getting better. That's so cool. Um, Today, 2 weeks later, um, I've been having spasms every night for the past um, what, like 5 nights now. I don't know. It's like, don't say stuff out loud because it's gonna, it's gonna reverse. Um, but overall, they're not affecting my day. In fact, the other two, what, 3 mornings ago, I felt fantastic. I was having spasms for the better part of the early morning, and I woke up, got up, helped my caregiver pretty good, I thought, and I was doing great, hardly in pain at all. Um, you're gonna get better. Um, Sometimes it's hard to see that if you're in absolute pain. I'm taking more meds than I ever used to, which is weird. Um, but I believe I will not have to be on all these medications next year. I really feel like by next year I can come off of at least one of them. I don't know, but um, I don't know. Anyway, look to the future. Why did you want this surgery besides not being in pain? You want to get back to the things that you want to do. I want to play with our boys. Um, when we got Louis, December of 21, I was not having these issues. I could play with him. I could crawl around the house with him. I could do our little wrestling thing, and I was not hurting. Um, 4 months later, in 2022, I started noticing all these things. So Louis, I guess if you want to say, witnessed my decline and awfulness. By the time we got Milo, I was full blown hip dislocated. I was awful, and actually, I feel like Milo is seeing me get better now too, because, like I said, I am better than I was last May for sure. I want to get back to playing with them. I want to get back to going out more often. I know Jason misses that, and he's very, very patient with me. And but he misses that, and I miss it too. Maybe not as much as he does because I'm like, okay, well, this is your life right now, so just whatever, just so. But I want to go to the mall. We used to have Starbucks days. We used to just walk around town or whatever. We used to that'd be cool again. But it would be even cooler if I wasn't in pain while I do it. And so that was one of the main reasons I don't go out as much. I just want to get back to my life. And I don't think I'm putting a wedge at all when I say if I'm 80% better when this is over, I'll be perfectly happy with that. I don't think I'm like putting it. What am I trying to say? Like, I don't think I'm like Um, but
You're not trying to make a new norm for yourself. You're not trying to minimize
like, well, this is as good
your,
as it's gonna get. It's
yeah.
not gonna get to the way it was because it could, yeah.
I mean,
But
when we just when we when the pandemic started, we were like, "This is our new norm." You don't want that to.
yeah,
You don't want 85% to be your new norm, but that's something
but
you can make peace with.
yeah, yeah. If that is as good as I'm gonna get, I could still fully function. I could still get on the toilet by myself. I could still, you know. So, but the future is going to be way better than the past 2.5 years. That's my cell phone. If you guys can hear that. As a side note, it's the dreaming. So, um, I, if there are any more rules, I tried to just kind of jot down the main ones. Um, I feel like these will help you, and I hope they do. I really, that's my goal to shed some light, of course, um, on this because, especially from, a critic's point of view, people don't talk about this. They don't, and if I had gotten surgery here in Midland, um, my doctor would be like, okay, you need to be bed down for 2 months and you need to do this. And I mean, it would have been um, not as hopeful, I think. So, one key, find the right doctor. And if you have to look, it's okay. Like I said, my third one, he did say the same thing everyone else said, but he made it clear to me, and um, I felt better, even though I was still scared and everything. I felt better going with him. So that's one thing. Find the right doctor that you can talk to, and try to keep these rules in mind. I think, yeah, and I don't know. Oh, I just I don't know what else to say, but I think I hope this helps you. If you want to ask anything or comment further, please, drop your comments. Um, and if you like it, share it with your friends. If maybe you know somebody who's having surgery or you are facing that. Um, and so yeah, I just thought I'd share my experiences. Um, so the next time I see my surgeon will be August, and I'm sure I will have a lot of good things to say by then. What is it? April,
The
July,
13th.
August. So yeah, that's 4 months away. So I'm sure within 4 months I will be pretty good. Because I'll be 10 months out from surgery. And it's okay to, you know, I'm like, oh yeah, 24 weeks. Oh, eh, for a while it was like, I'm 2 weeks out. Oh, I'm 3 weeks out. I'm 4 weeks out. Yeah, that's okay. It's kind of exciting, I think. Um, but just keep in mind, make expectations, be realistic, be kind to yourself, be upfront with people, look to the future. Thanks, guys. Love you.